Well, I guess it makes sense in an event called Ideas Without Borders to invite doctors without borders, right? So it's a real privilege to be here. I want to thank you for sharing this time with me. So maybe some of you, you're not so familiar with Doctors Without Borders. Doctors Without Borders is one of the biggest medical and humanitarian independent NGOs in the world. It was founded back in 1971 when some French doctors, they came back from the field, from doing medical assistance, and they said, well, this maybe is not enough. We have to do something more. So they put together some group of journalists so we could also speak out on the situation of the people who suffer this crisis, and also sometimes pointing our finger to the people responsible for this situation. So Doctors Without Borders starts in France back in 1971, joining doctors and journalists. And since then, we're almost now 50 years old, and we're facing a large number of challenges, as Doctors Without Borders, but all of us as a collective human beings. Conflicts, we have seen a significant increase of conflicts in the last 10 years, more than 100 conflicts happening, and moving from the classical thing of a front line and having two armies fighting each other, to situations where you have immediate tens and dozens of armed groups with very different agendas and choosing large cities as a battleground. So the suffering for the civil population is even higher and higher. We're also seeing climate change that is going to change everything. We're going to see more natural disasters. We're going to see more malnutrition. We're going to see more conflict. And we're going to see more people moving from north to south and south to north. We also have a political system, an international community that really struggles to find durable solutions to crises that seem to drag year after year, with all of us unable to find solutions to these kind of situations. We're going to face complex outbreaks, like Ebola, for instance, affecting large cities, and outbreaks today, they move much faster than before, like people. So today, outbreaks fly or they drive, so we're going to see outbreaks that's going to also come from south to north, from north to south, and we have to get ready for this. Of course, population moving, escaping some of these situations, and also humanitarian work, like all of us, being exposed to the new paradigms of communication, Twitter, social networks, etc., etc., etc. So we're going to need new ideas, new ways of doing things to tackle some of these challenges. The good news is that in Doctors Without Borders, MSF, Médecins Sans Frontières in French, somehow innovation is in our DNA, right? I told you already that it was a quite innovative idea to put together doctors and journalists to tackle some of these situations. But also in terms of innovation, for instance, in our story, only some examples. Back in 2003, for example, we partnered with other institutions and we started what we call Drug for Neglected Disease initiatives. We have a problem because the pharmaceutical industry focused more on investigations for drugs for the developed world, leaving aside some of the diseases that affect more the global south, the third world, like tuberculosis, like Kala-Azar, like trypanosomiasis, etc., etc., etc. So we partner with other institutions to try to investigate and cover this gap. I knew today I was facing an audience with a lot of people from marketing and communication, so this was a very successful campaign we did in Spain. I come from Barcelona myself. So basically, these were some tablets, some caramels, some mint sweets you could buy in your pharmacy for €1, and with this money, we bought drugs for people we assist in the places we work. You will maybe recognize maybe Andrés Iniesta, because at the end of the day, football is also a language without borders. The other ones are well known, but more in the Spanish society. And yes, and for instance, we're now incorporating new things. For instance, virtual reality. We use it for training. We use it with our staff to try to simulate situations, but also with the general public. It's a very strong tool because we record videos in the places we work, and you know that with the virtual reality, we can somehow bring this experience closer to the people who support MSF. Now, when it comes to organizations, humanitarian organizations and private sector, I think we have to find ways to communicate better, to know each other better, right? So let me use some of my personal experience to find a way. Some years ago, I was teaching in business schools, right? You know, MBAs, this kind of masters. And we were talking about models of management, and I was trying to share with people from private companies what are the models of management in MSF, in Doctors Without Borders. So what we do in Doctors Without Borders is we take a group of highly qualified professional people, doctors, nurses, journalists, finance people, right? And we send them to really hard situations, Yemen, South Sudan, you name it, right? So these people, they go there, we pay them a salary which is below the average salary they would get in the home societies because we don't want them to go to these places for the money, so we pay a lower salary. Living conditions are not nice, you can imagine, in Yemen or in Darfur or in the Kibbutz or in Central African Republic, not nice living conditions. On top of this, they work for long, long hours, sometimes 10 hours, 12 hours per day, including weekends, etc., etc., etc. But at the end of the intervention, after 3, 4, 5, 6 months, if the intervention has been successful, these people, they come back to their home places, but they're willing to go out on another mission. So I was explaining this to people from the private sector, and this businesswoman came to me, and she told me, well, David, I mean, you just described the dream of a businesswoman. I mean, as a business person, I would love to hire a highly qualified group of people, pay them a salary below the average, get them to work long, long hours, 12 hours per day, 14, including weekends, and after 3, 6 months, these people be delighted to have experienced this, right? So I think this is interesting for people from the private sector when someone came to me and talked about this dream of a business person, right? So let's keep this idea, and we'll come back later. Because MSF, Doctors Without Borders, is one of the biggest medical and humanitarian organizations in the world. We have more than 6 million donors, private donors, who give money to Doctors Without Borders. And we have today an annual budget of 1.5 billion euros, right? More than 40,000 employees all around the world, okay? So we are quite a successful case in terms of business case. I mean, in terms of size, right? But in terms of financial business, we are the worst business in the world. The worst business in the world, because we get this 1.5 billion euros and we try to spend it all. We try to spend it as much as we can. Doing this kind of things, we do more than 10 million outpatient consultations. We do more or less 300,000 deliveries. We treat 80,000 severe malnourished all around the world, 2.5 million cases of malaria, in all these kind of countries, right? So people who support MSF, they give us money, and we spend it all. And the only thing they get in return is maybe 2 letters per year, thanking them for the support, and an annual memory, you know, so they can see how we have invested the money. So it's the worst financial business in the world. We spend all the money. So how can we put together these two ideas of the dream of a businesswoman and the worst financial business in the world? I mean, it seems completely contradictory, right? So we're missing an element here, okay? There's something missing that helps us to put this together. So to navigate through this impossible equation, let me use an example. We're all familiar now with climate change, right? All of us. Well, there's some very important people that still are not yet there, but they'll make it. Huh? But overall, we are all aware of the climate change and the consequences it's going to have in the world, right? And we know already that when it comes to climate change, we cannot simply delegate and tell, for instance, to the people of Greenpeace, you know, this well-known ecologist NGO, you know, guys, you take care of climate change, you know, because I don't care. This, we know it doesn't work, because people from Greenpeace, or we all know this is too big to delegate to a small NGO. So somehow we have all decided we have a role to play. when it comes to climate change, right? Why? On one hand, we have decided it's a good thing to do. As human beings, as society, we give ourselves some laws, some principles that help us decide what is good from what is bad. And today, if we voted today and we said, who thinks fighting against climate change is a good thing, most of you would raise your hand. This wouldn't happen 20 years ago, but now, yes. So we all agreed that it's a good thing to fight against climate change. We also decided that it's necessary. Unless we want the Bosphorus to flood Istanbul, we have to do something against this, right? And we're all concerned about things related to climate change that happen in Australia, that happen in Africa, that happen in Latin America, because we are aware of the global problem. So we have decided it is necessary to engage against climate change, right? Now, is it profitable? More and more companies, and you know this better than me, have understood that they have to go eco-friendly because the customers are requesting some level of social responsibility from companies, and specifically when it comes to climate change. So basically what has happened with climate change is that we have all decided as individuals and as institutions that we have a role to play. We cannot delegate this. We have to take care of our planet. Now, what happens with human beings? What happens with our fellow citizens? In Doctors Without Borders, when we go to a conflict situation, a natural disaster, or a famine, what we do, our objective is to save lives, to alleviate suffering, and to restore dignity of the people affected by this crisis. Now, we're all aware of this crisis. So, doing a kind of parallel exercise with climate change, can we say, no, you know what, these guys of Doctors Without Borders, we're going to delegate on them. They will take care of this crisis. And the answer is no, we cannot. Because even with a large budget, we are completely overwhelmed by the number of crises and the level of suffering. So no, delegating is not an option. Now, is it good to engage in humanitarian crisis? We have already answered these questions. We all agree that it's good to treat a malnourished child, wherever he is from, even if he's from Central African Republic, from Yemen, from South Sudan. We don't care. We have collectively agreed, is it a good thing to do? Is it necessary to engage? If you analyze any significant humanitarian crisis, you will see it's not a local problem at all. There's always other countries' intervention, regional powers, political agendas, economical multinational agendas. So yes, the causes are global. And also the consequences. Today we have more than 65 million people refugees and displaced. You know very well what I'm talking about. So yes, the consequences are also global. So it's necessary to engage. Now, is it profitable? Well, I already tell you about the successful business case. 6 million people give money to MSF, right? And more customers or potential customers are requesting to companies to also fulfill the social responsibility when it comes to humanitarian crisis, right? So you remember we were lacking an element with the businesswoman dream and the worst financial business in the world, right? So we think this missing element is humanity. We like to think of Doctors Without Borders as a chain of humanity. 6.5 million people who give 1.5 billion euros to more than 40,000 employees that treat all these millions of people in these communities affected by a situation of crisis. Now, let me share a story with you. I was this last month of July in Central African Republic, right? And now I'm the president of MSF Spain. So before I was in the field as a doctor, but now I have a more institutional role, okay? So basically, my role is to go to these places and meet people who believe they're very important. So I go and I meet the Minister of Health. Hello, Minister of Health, how are you? I meet the Minister of Interior. Hello, Minister of Interior. And then I go to see the rebel groups because we are neutral organizations, so we engage with both sides. Hello, how are you, Mr. Rebel Leader? How are you, Mr. Minister of the Rebels, of Health, whatever. So I do this thing. This is my job now. And I tell them, okay, you know, guys, you take care of the conflict. We will take care of the victims. Huh? So can we work here? Yes, yes. Okay, so we can open an hospital and engage. On my last day of the visit, we were rushing back to our base, and we had to rush because we have a curfew at 6 p.m. We have to be back in the base because we are not allowed, for security reasons, when it's nighttime, to be outside of our base. So we're driving back, and suddenly, in the middle of nowhere, Central African Republic, this gentleman waves at us and stops the caravan, okay? And he's one of our staff. He's a Central African member of Doctors Without Borders. It's a health community staff. It's people we send with a bicycle, you know, to the remote areas to treat patients in these remote areas. So he stops the convoy, and there's a child, 2, 3 years old, with the mama, and the child is clearly affected by a severe malaria. Okay, so high fever, anemia, kind of unconscious. So we rapidly decided to put him in our car, right, give a very rapid first assistance, but to rush to our hospital, which was only 15, 20 minutes away, so he can receive a good treatment. I have no idea of the name of the child. I have no idea of the name of the village. The only thing I know is that the kid is now okay. So here's where the chain of humanity engages. So all these people gave money to these professionals from all around the world to treat this patient who we don't know who is, where from, because we don't care, because we recognize him as a human fellow being. So this is the element of humanity that brings together this, what appeared to be an impossible equation. So, but we face a lot of challenges. You can see the list of places we're working here. So I brought a short video to see what are some of the new ideas we're bringing into place to try to tackle some of the challenges we face.
Innovation helps us save lives. Making sure that our help reaches those who need it most can be a daunting challenge due to countless obstacles. Many times, the obstacles we face are logistical, like how can we treat patients in places where there are no roads? We're constantly working to develop new and innovative ways to deliver care to people who would otherwise be cut off from essential health services. In Nigeria, we found ways to monitor for malnutrition cases using mobile phones. In Papua New Guinea, we've collected patient samples using drones. In Nepal, we used an inflatable hospital to treat earthquake survivors. We also launched an ambitious telemedicine program that allows isolated field doctors to connect with specialists from around the globe and treat more complex cases. For example, we helped develop an Ebola vaccine based on the knowledge we gained from working on the front lines of West Africa's Ebola epidemic in 2015. We've also developed a special fund dedicated to developing solutions to some of our most critical challenges. We're investing today in innovations that will help us save lives in the years to come. Thank you so much for watching MSF's Pulse. To learn more about how we're innovating the humanitarian world, click the link in the video description.
Okay, so I invite you to visit MSF Pulse to see what kind of innovations we're doing. Let me tell you a story about this. In a hospital in South Sudan, for instance, we had this woman, pregnant woman, who came to our facility, and she was clearly in distress. She was breathing very heavily. And as I said, she had an advanced pregnancy. So we just had a general practitioner. This guy was from India, right? But we still have an ultrasound, a portable ultrasound machine. So this doctor was suspecting of a heart condition. So he did an ultrasound of the heart. But of course, he didn't know how to read it. So he sent it to a service of telemedicine, which is based in Canada, right? And then a Canadian doctor took that clip, that video, and sent it to a cardiologist sitting in the United States. And the cardiologist confirmed the condition, the heart condition of this woman. So then they were put in contact with an obstetrician from Australia. And then also someone from the field of anesthesia who was in France. And they all came together with a medical plan that was sent back to the Indian practitioner in South Sudan. So a C-section was recommended, and the lady is now okay, and she has a beautiful young girl. Again, another chain of humanity, another example of chain of humanity having impact in individuals, and by having impact on individuals, having impact on all of us. It's true. Oh, I know, I switched it off. Okay, now here. So we have 40,000 staff, as I said, deployed from all nationalities, more than 150 nationalities working in MSF today, deployed all around the world. And they all have all these kind of ideas, and they face new challenges. But we had problems. We had problems sharing this knowledge, escalating solutions, you know, people finding solutions in a given context that for sure could be good for contexts elsewhere. So we came forward with this kind of tool that also I invite you to visit. It's an innovation portal where everyone can somehow place new ideas, new challenges. Basically, we're trying to eliminate barriers when it comes to innovation between our teams in the field. Now, maybe you're asking yourself after my talk, saying, well, okay, what can we do? Is there anything that we can do to somehow play a role in front of these kind of situations? And the answer is yes, so there's hope. And yes, you can support NGOs working in this sector. And for instance, maybe Doctors Without Borders, right? So it's something you can do as individuals and as institutions. But you can do more than that. You can also help us spreading some of these ideas, some of these concepts, giving some level of visibility to people suffering this kind of situations, our fellow human beings. You can also help us, because you from the private sector, you're very strong when it comes to innovation, when it comes to new models of management, when it comes to developing projects, etc., etc., etc. So we can find an interface to talk to each other, humanitarians and private sector. Now, what if in a place like this, in an event like this of Ideas Without Borders, we somehow agreed and somehow committed that the best possible innovation, the best possible idea is for all of us as individuals and as institutions to put humanity in the center of everything we do? What if we commit to try to find our place in this change of humanity, as we do with climate change, you know, in order to contribute to alleviate the suffering and the mortality of the population who suffer the most? I think we could all agree that would be the best and biggest innovation out of a forum like this. This would certainly be a success for this event, a success that will go beyond Istanbul, a success that will go beyond Turkey. It would certainly be a success without borders. Thank you very much. Thank you.